Is now a good time? Not really, but what's going on? How can I help? Grandma's dying. When did you find out? This morning. Oh, how are you holding up? Before you get into that, I would just love to get through the PTO policy at our residency with you. So essentially, Grandma she's not covered by the PTO policy. This weekend, they say it's this weekend. Yeah, it's already Thursday. Oh, well, in terms of finding coverage for you, you could find coverage for yourself. You just have to find someone to swap with. You did find someone. Who'd you find? Oh. Right, they're the only person. Unfortunately, as much as I would love that, as much as I can move things around for you, as much as, let's say, there were other people at the hospital who could help, like attendings or fellows or something, no, but as a resident, you committed to this job. The person who you would like to swap with, and even though they agreed, they're not covered. No, because they're on backup. Right, that would be an inappropriate usage of the backup system. We've done it before in the past. Well, those were extenuating circumstances. There were some things that were happening, things you would never understand. Should you want to take some days off for mental health? Absolutely, we're here for mental health. Just know that any days that you do take off come out of your PTO, you will have to pay the person back and it will delay your graduation. So you have to ask yourself, can you not work through it? Or is it something that you could push through, give it the old college try, and not need to pull out, or not need to call out? If you called out, you would have to make those days up. It would delay your graduation. How many days? Well, you see, everything is it's a moving target, right? Residency is a moving target. These things aren't really written down. You're not really allowed to miss many days, any days off. PTO is kind of a concept here across the country, right? You said it's across the country, yeah. You could fly 3 hours there, spend an hour with Grandma, say your goodbyes, come back, and you have your 24-hour shift on the weekend. That's the best that I could do for you. You might think that that's something that I might worry about, or that the program cares about, but honestly, we care about the patients, right? And so there are other grandmas here who need to be taken care of, because think about it this way, right? Like you came into this field, the standards are so high. Let me give you a visual representation. These are the standards. When you became what? Yes, that's right, a doctor. And the standards for doctors are up here. They're up here. We have it written in that you have personal days and mental health days and PTO days. We don't. I mean, that's just me being honest with you. We have unlimited rights to hire you, fire you, abuse you at will, because you signed up for this. It is what it is. This is residency. And if you don't like it, I don't know what to tell you. I mean, Grandma's gonna die one way or another, so it's really just how you handle it. To go home and reflect on, consider your professionalism. We would absolutely love to help you, but just the constraints of the system don't allow us to make it possible for residents to take care of them.